It's a disease that probably has affected someone you know. Nearly 40% of all Americans will be diagnosed with cancer at some point in their lives. And now pharmacy students in Ohio believe they found a drug to target the most aggressive form. Bree Malaska has a look.
What they have right now is great in terms of treatments for glioblastoma, but it's not enough just because of the kind of tiny survival rate you're seeing.
Glioblastoma is a cancer that develops in the brain or spinal cord and is nearly impossible to remove. Experts say the 5-year survival rate is less than 10%. But researchers at the University of Findlay may have created a drug to improve that statistic.
Looking at activity we've seen from drug compounds treating glioblastoma in the past, we've kind of used a molecule, what's called a chalcone. That's just a type of drug molecule. But basically, it's something actually found in curry, I guess.
That's right. The compound called chalcone can be found in curry, the popular Indian food. Dr. Raul Kupsi is a medicinal chemist working on the project. He grew up in India and says he discovered that chalcone has anti-inflammatory properties as well as anti-cancer properties.
So in my grad school, I have worked on natural products and that was kind of like an inspiration for, making these designer drugs, right?
So they worked to develop a new compound that they've nicknamed RK15. One of the major breakthroughs about this compound is its selectivity to target only the brain cancer cells while sparing the healthy cells.
Selectivity is the holy grail of cancer therapy, okay? Because we know that chemotherapy has a lot of side effects. So how do we achieve that selectivity where our compounds can only kill brain cancer, glioblastoma, and spare the normal brain?
RK15 also penetrates the brain-blood barrier, or BBB, which is the brain's defense system, while also targeting the resistant cancer cells. Researchers say this makes RK15 100 times more selective towards the infectious cells.
What if by chance something were to have activity and down the road someday I look back and think wow, that's the drug I worked on, and here it is saving lives.
Experts say it typically takes 10 to 15 years for a new drug to get from the lab to the patient. A new study found the U.S. is throwing away a shocking amount of donated kidneys every year, as many as 3,500. According to researchers, between 2004 and 2014, more than 17% of donated kidneys were discarded, and that number has only grown. In 2016, they found the rate was about 20%. Researchers blame the rate on transplant centers' reluctance to use organs that aren't in the best shape and the lack of a universal method to decide on if a kidney will be used. More than 37 million Americans have chronic kidney disease, and 5,000 die each year waiting for a new kidney. President Donald Trump addressed the issue in July and signed an executive order promising to transform kidney care in the U.S. The measles outbreak in the U.S. continues to grow. According to the CDC, there were more than 1,200 reported cases in 30 states as of Friday. More than 75% of the cases were linked to outbreaks in New York. The Michigan Health Department has reported 44 cases this year. That's the highest number of measles cases since 1991.